Good evening, friends and viewers of Aware and Care, your weekly Ayurvedic dosage with Dr. Ambika Nair, who's a co-founder and chief consultant at Santhigram group of companies. In this weekly program, we bring together here some unanswered questions and some queries, and also to live a healthy lifestyle, mind, body, and soul together. To answer all these questions, of course, we need Dr. Ambika Nair here on the screen. Let's welcome her to the show. Namaskaram, Doctor. Welcome to Aware and Care.
Namaskaram, Madhavi. How are you doing?
I'm doing very good, Doctor. Lifestyle changes is my Maha Mantra every morning. And we've been very fortunate to be having the series during this pandemic where many of our questions are being answered with your kind consultation here online. And we are so glad to also inform to you that we've been getting tremendous feedback in the form of questions from our viewers. And in one of the coming episodes, we're going to touch base on some very sensitive and private questions of our viewers, which they many a times in their own words feel very awkward asking the question. But I think with your help and with my little effort here, we will be able to help them out. And
no question is awkward actually, because it is a medical question.
Yes, it
and
is
especially people are very much skeptical, and they feel shy to ask about anything about gynae questions and all.
Yes, we will definitely take that up. And in today's episode, I always say that, there are so many sore topics that we have touched base in this program, Aware and Care, in the last many, many weeks, about close to nearing about 40 weeks that we have done that. But in today's episode, we definitely are going to touch base on a very sore topic, that is cankersores, also known as mouth ulcers, and they have so many other names. We are always confused whether it's because of a bacteria, because of a virus, because of my braces, hormones, or is an accident, or because I bit my cheek. All that you are going to explain to us. What are cankersores and where do they all start from?
Everything is included. Whatever you told, everything will be there, but only thing you should be able to diagnose it properly.
Okay.
So we call it in Ayurveda, we call it as mukha, paka. Pak jata hai. People, because they send me so many in YouTube and all, why you don't speak little bit in Hindi?
Okay.
I don't know, because they think that Malayali doctor, they don't know Hindi. I am very good in Hindi, and you can ask in Punjabi also. All the languages are good for me, but I can answer. Everybody is welcome to my show.
Well, friends, before we continue with the questions with Dr. Nair, I personally can vouch that Dr. Nair is so comfortable with so many languages. Well, the main concern is your health. And once she touches your pulse, she knows exactly what's happening inside your body, despite whatever language you want to communicate with her. Okay, but Aware and Care is basically in English so that we cater to everybody's viewership and we get our audience in a wider range. So today we're talking about cankersores, and we're going to ask Dr. Nair as to what are these mouth ulcers and who gets them the most and where does it come from?
It's actually, people ask whether you will be able to diagnose yourself or you need any, diagnostic tools. Actually, mouth ulcer is called a canker. So how it will be first, some people you can see so many spots will be there. Some people that spots, it will grow together and it will become very big, deep ulcer.
There's a cluster of it, basically.
Cluster of this one. And something, you can see only one will be there. Some will be on your, in between the teeth, on the gums, it will be there, even on tongue. I have somebody from Pune that I am treating now because he's in India. Some of the, people from here, they know me. So they told that because he is suffering since 40 years.
Yeah, I've heard about
it. So it has become like a lichen plant, so that is also there, the color it was very bad actually. Anyway, I have saved him, I should say. I don't say I am saving through me, he is okay, because God is the one who saves people, right?
Absolutely beautiful. So, Dr. Nair, let's start with the basic about these sores. Friends, we're talking about cankersores that comes under the lip or between the gums and
no. It can be, see, if you bite that is also, you can see sometimes, white lines will be there, or it will become like a yellowish. It will first, then, very painful. If some people, if all these things, these sores, this ulcers or all these things. If it is, like some days, sorry, okay, sometimes it can be like 40 days, then, like 10 days. If 10 days, it is very simple. Okay, if little more, see if it is lasting for more than like 14 days, like then you can see that, and even more than 14 millimeter and all. So the width is also how deep it is, that has to be taken care in that. And you can see then, like it will take a long time. Something will happen like every month it comes. People say that, like when I am very tense, I get it always. When the sleep is not there, when the digestion is not there, when you are like, you are on any other medication or any autoimmune disease, your hormones are not placed properly.
Wow, so many factors.
So many factors. Something will tell, some people will tell that because of they have like a very, sharp teeth. So that same place, they keep on getting ulcer. So these things, that they should go to the dentist and get it, like they will grind it properly and they will be saved from there.
Okay, Dr. Nair, we've spoken about so many things. We just started with cankersores, but I think let's also go back to one more basic of how we all try to understand when you explain something to us. There is no age limit or age group of people, no gender specific. This
very young children also, until even 100-year also, people will get it actually.
What kind of body composition people get this the most? Because
it can be anything actually, even vata, pitta, kapha.
Okay.
But normally we have seen that, like high pitta and kapha people are more prone for these ulcers actually. And, like there are so many other predisposing factors, because sometimes these ulcers can be because of your, like you have some underlying another major issue in your body. Okay, so that may be another disease. So this will be a predominating symptom also. Okay, so even stomach ulcer, acidity people are there. Like then some people will get a fever also along with this, and they lose weight. That is also there.
Fever also along with cankers?
Yes, some people will get like even like 100, 99, like that, because very infective it becomes actually. Yeah.
I think the most important thing which I have noticed of some people that I know personally who've had cankers all their life, it is so traumatic. They can't enjoy food. They can't smile. They don't have anything. Even if they've been married or they've had kids, there's something about food that they detest, and it is a psychological impact. So that's how uncomfortable is canker sores. If some of you watching there has one or two sores and you're finding it very painful, imagine a person with having multiple of them and clusters on regular basis. Now, Dr. Nair, please tell us, who are the kind of people, what kind of body composition people have it on regular basis, chronic?
Regular basis, pitta people are more common with this, and the kapha also. Okay, and like people who chew the tobacco a lot, smokers, even like liver issues, ulcers, like IBS people, gastritis, all those things I have seen that like they get it, and like some people on depression.
Depression also. Stress also brings
personal. Some people with a personal hygiene, very less hygiene. They don't take care of all those things. That also it will reflect on them.
Dr. Nair, as you're telling us this personal hygiene aspect of it, we are using more and more OTC products for our oral hygiene. Maybe there are some mouthwashes. People are so paranoid. They constantly use, very frequently used mouthwashes. Does that also create that problem by scraping?
It all depends upon the quality
of the pad. Okay.
Yeah, because actually, like you see, like if alcohol use so much of, and they will be using cortisone. Some people will be, like for other diseases, they will be using the cortisone also. So, like why you should be able to diagnose the case, Madhavi. Why they are having, whether it is related with any other disease, or whether it is just a mouth ulcer, whether it is any, like a vitamin deficiency, whether it is related with the digestion, sleep.
Okay, Dr. Nair, now let's also come to the point where of an adult who doesn't have any dependents in the house, he or she is living. So we will talk about them later. But we are usually, man is a social animal. He's surrounded with his family, friends, or children at home. How contagious is this problem when you kiss somebody, when you use the same spoon or the same glass, or is there anything to do with that also?
No, nothing will happen like that. Unless if it is not cancerous.
It's not cancerous. How do we find
because
cancerous?
No. That should if repeatedly, like if the canker is there, especially with the lichens and all. So
Okay.
mouth lichens and all, it is very painful. Then we have to see that they should go for the care with the cancer specialist. Nothing should be repetitive.
Okay.
If it is continuously coming, it's a small canker, on and off. When the weather changes, sometimes it is very, we have seen that rainy season, sometimes it comes like that. Okay. So vitamin B12 deficiency, that's why they will tell you, oh, take a B complex, you will be fine.
Yes.
Okay.
And what about it comes with cold? That is different and this is different, it's the same? Cold.
It can be both actually.
It can be both. Okay.
Sometimes it will be with the cold also, sometimes without cold also. Then you can see, if you look at their tongue itself, you will see that, how coated their tongue will be. White coated. They will have constipation. Okay. Sometimes, mucus will be there in their stool. Okay. There are so many other diagnoses actually.
So the best way first to see if anybody out there who's having a frequent canker sores is to first understand the underlying causes. And like Dr. Nair just mentioned, that if it comes once in a while, there's nothing too much to worry. They take whatever is a nutrition and supplement, which you will mention in the later part of the program, and relax with it. Anything that comes frequently, chronically, and comes in a pattern is something that you need to go and get tested. As simple as a canker sore. It is not simple. It's a very painful problem. It is basically ulcers inside the lower lips or in the mouth. So Dr. Nair, let's start with what kind of nutrition deficiency or vitamin deficiency creates this?
Vitamin B12 will be there. Iron deficiency also will be there actually.
Okay.
Yeah, so many, because then vitamin C. Yeah, all these things, that.
What about genetics?
Zinc deficiency is also there. Zinc.
Okay. And does genetics also play a role? Does it happen that, it comes in one particular family more frequently?
Very, some people will come and tell me, but, it's negligible, but sometimes it can happen also. Yeah.
And what about toothpaste and those kind of things?
Yeah, teeth problem, very vigorously children will, do the brushing, that. Competitive way of, especially in the hostels and all, you can see that that is traumatic actually, because they will hit the gum or they will, because it's on the mucosa. It is our mucosa is very thin lining. Okay, so that will just bust out actually. In Vata people also, because very thin mucosa, any irritation, it can bust and there will be a big canker over there.
Okay, next is my favorite question: curable, completely preventable?
It can be. It is completely curable, but only thing, we have to have little lifestyle changes in them.
Okay, and I think there's
that
a very
is more important.
Strict code of conduct for particularly for canker sores, for the food, diet.
Yeah.
So
because
actually, comes to Santhigram, let's get to that.
Yeah, because see, once somebody comes, because I am not. First of all, these people will avoid how to come, they will go with the home remedies. When nothing works, only they think of going to any doctor, whether it is any, but see, if it is burning sensation, some people will complain to me. My tongue is burning, but that is not a good sign actually. Okay, so then they should definitely go and meet the doctor. Okay. And tingling in the in the tongue and in the mouth area, all these things will be there, and they will not be able to speak properly.
Okay.
Yeah, because that tongue become heavy with the ulcers, and when you see that the drooling will be there with the saliva. Oh, it's very difficult. I have seen so many cases like that. Okay, and then they lose weight. In this condition, how they will eat?
That's right. Okay.
Okay, so it's a very difficult thing, and they won't be able to eat anything actually. But not only it will be ulcer sometimes everywhere in the intestines also.
Oh, it could spread that.
Okay, so that is also there. Then it will be very painful and very difficult. We come across such cases very often.
Hmm. So, Dr. Nair, you did mention about hygiene. So, I'm like you were just mentioning that it is so painful. So, must be so difficult for them to keep their, dental and oral hygiene also because of
Yeah,
this.
we tell them, there are very good mouthwashes in Ayurveda. And if no Ayurveda medicines are also there, they can buy a little bit of glycerin.
Glycerin. Okay.
And if nothing is there, they can do gargle. Actually, it's very painful when they do gargle with the salt, because salt cut will be there, no? And it is very that because I know how difficult it is. But I tell them to keep little bit of, if nothing is there, at least little honey, they can keep it in the mouth with water. So
Okay,
it has a little bit of hygroscopic action, and it will help them a lot actually.
That sounds very hopeful.
Yeah.
So, Dr. Nair, what kind of dietary habits should people implement when they have frequent
Only cooked food. Only cooked food. That also without any spice. No spices away. Like a coriander, we tell them.
Okay.
Coriander, they can do it actually. They use also coriander.
Dr. Nair, you just cooked food. So, what about salads and fruits?
Salads, they won't be able to, because that it will be so painful. They won't be able to swallow.
Oh, okay.
Soups they will take.
Soups they can take.
Yeah, but khichdi, our Indian khichdi is the best actually.
Yogurt
will not be allowed. But buttermilk we will tell them to take it actually with this. Okay. So that will heal a lot.
Mm-hmm. So what kind of food should they avoid?
There's all spices, especially for Telugu people, no spice.
Only spices. So no vegetable restriction, no particular,
No, that we will say that because according to the constitution only we'll be able to tell them. Okay.
That's right.
But heavy, like if their appetite is okay, but we have to see whether their, like digestion is good. If not, it is very difficult. Whether they have constipation, okay, whether their sleep is better, what type of constitution they are, why are they suffering, whether they need any panchakarma, what type of diet they are following, whether it is digesting.
Okay. So friends, from the takeaway points from what Dr. Nair right now is saying, of course, she will add in if I'm anyway incorrect somewhere, that there is no dietary restriction on this particular during the treatment. You can eat any food that you want. It is just a myth sometimes that, maybe this food is creating a problem or that food is creating a problem.
That if they are allergic, Madhavi, because some people will be allergic.
Okay, allergies are completely a different topic, friends. So
celiac disease. There are so many things. That's what I told you. Diagnosis has to be proper. Sometimes celiac disease, then they cannot eat any wheat. Why the ulcer is coming? We have to find out the root cause.
And that can only happen through a visit to the doctor.
No, that can be taken care. Unless they go to the doctor, they will only be able to help them.
Okay. So friends, like when you eat any food and the burning sensation comes, it's not because of the food, it's because the ulcer is so painful and it is so open, the wound is so open, that's the reason it hurts. And like Dr. Nair just mentioned, no food is restricted, but you have to have cooked foods. That is primarily important. And of course, with that
without spice.
Without spice, and the supplements and medicines which are need to be provided will definitely be told by Dr. Nair. Dr. Nair, what other food vitamins do you recommend apart from B12 that they should?
Folic acid. Folic acid is very good.
Folic acid also.
Yeah. Okay. And like what they should do at home, turmeric. They can, with the turmeric water, they can, do gargle actually. And they can put another best thing I'll tell you is that with the red onion.
Okay, what do we do with that?
Okay, red onion, take the milk, like a half cup of milk and a half cup of water. Chop a small onion, boil it for like 5-10 minutes. Okay, it will become like a half cup.
Okay.
That will reduce very fast actually. It is very, very quick remedy. This is from my father, this is my from like when we used to get all those things, my dad will tell my mom. do this, and it really, I part this, like a memory with all my clients.
Fantastic. Dr. Nair, I have a doubt on that. Do you drink it? Do you rinse it with that?
No, drink it. I don't drink it.
Drink it. Okay, sorry.
Yeah. And sometimes, herpes also can happen, like a very, very, so that's what I told. Diagnosis is more important. Actually, simple things, if it is a small ulcer, that is nothing, and it will come for a few days, it will go away. But if it is like continuously staying there and, making your life miserable, please see a doctor and do the needful.
Okay. And what about the mouth rinse that you said with salt water? Do they do it with warm water or cold water?
No, I told you with the lukewarm water.
Lukewarm water. Okay.
Yeah.
So any aspects?
Honey is also very good, actually. Honey is very good. I have seen that. And Ayurveda, the mouthwash is there. There are so many other gels are also available now.
So friends, what we understand from today's program is cankersores is curable, treatable, preventable, all once you get diagnosed as to what is your body composition type and why it is happening. Is there an underlying health factor that is bringing the frequent outbreak of cankersores? And a visit to a doctor after you've tried everything. Well, of course, Dr. Ambika Nair and her entire team is also available. Not many restrictions are there during the treatment of this particular problem, because the basic is all about food. And once you eat the food and you feel full and you feel nice.
Basic is all about digestion.
So your mind also starts working, and then you are able to concentrate more on things, because a hungry stomach, a hungry tummy, of course, the mind definitely does not focus on a lot of things. So it affects your daily life and your relationships also. So let's try and avoid that, and please share this information with your friends. Please do not take your cankersores lightly. And if you see that the frequency is very high, you must consult a doctor. Dr. Nair, any final parting words from you for our viewers during this season for cankersores?
If they have constipation, they can take Trifala or they can take castor oil.
Mm-hmm.
Yeah. Orange juice is also good. Vitamin C.
Vitamin C is good. Okay.
Yeah, folic acid. One multivitamin.
Mm-hmm.
Okay. If they are having any problem, that's what I'm telling. So don't tell that because she told me to take all those things, and I was like, I think it difficult.
That's exactly my point. Every program that we have with you, this 15 to 30 minutes that we talk, many times I'm always wondering after the program, what did Dr. Nair say? She just said, eat healthy, feel nice, and just relax. That is a basic remedy for most of the problems, unless it is an extreme intervention.
Madhavi, actually, this is a rat race, our life. Okay, we forget to take care of ourselves. We will think that even look at the, the housewife. Look at yourself. Look at me. I will think that before going to work, let me finish all my work.
Yes.
So I forget to eat. You understand? But we will see that we prepare everything for the house, for our all inmates.
Mm-hmm.
But by the time we get into our work, we forget again.
Mm-hmm.
So we compromise. So that compromise will show on our health.
Yes, it builds up and it shows at some point.
Yeah, because we compromise and the body will not compromise. No, it will compromise for some time, but later it will show that I need care. That's why we are telling aware and care.
Aware and care, absolutely. Friends, many times you send me messages also asking that what would doctor suggest for this. Dr. Ambika Nair, her entire team is very, very approachable, and in the entire confidentiality and privacy, your questions will be answered. So please feel free to reach out to them. The number is there on the screen. The website is there. They have offices in the tri-state, and of course, global virtual consultation is also possible. Let's thank Dr. Ambika Nair for this wonderful episode today on how to deal and treat cankersores. And in the coming episodes, like we mentioned, your questions will be answered. So our viewers' questions being answered in the coming week. Thank you so much, Dr. Nair, for this episode today.
Yeah, thank you so much. And the only thing they should be able to see whether whether it is very deep or not. That's also there.
Thank you.
Anyway, thank you so much. Thanks a lot.